Hello everybody and welcome back to She the People TV. I am Dr. Tanushree Pandey, an obstetrician and gynecologist and also known as your gynae guru on Instagram. And today we are going to talk about a very important topic yet again, and which is pain in your vagina during sex. Have you ever faced it? Sometimes it's very sudden. Sometimes there's a lingering pain, sometimes you faced it and then it didn't happen again, or maybe it's happening again and again. So this pain during sex is known as dyspareunia. In medical language, it is known as dyspareunia. And it's something that should not be neglected because of course it can be very painful and bothersome. At the same time, there can be multiple causes for it. So what are the various causes that can cause pain in your vagina during sex or dyspareunia? So, to broadly classify them, it can be related to a generalized illness, a localized infection, a physical disorder, or a mental disorder. So, what do I mean by an infection? If suddenly you can smell something different in your vagina, a foul smell, or a smell that is different from normal. The discharge is increased a lot. It's greenish, it's frothy, it's itching a lot. Now, all this is a sign or symptom of a sexually transmitted infection or a vaginitis. And when that happens, that can lead to a lot of pain, dryness, friction during sex. Now, this can be passed on to your partner or you may have gotten it from your partner. So, you need to show it to a gynecologist and reach the root cause, what is it, and take proper treatment. Now, generalized infection, any illness that you get, just like how you have a generalized body ache, you're not in the mood, you don't feel like having sex, that can lead to vaginal dryness and pain again. So, this is going to be temporary. Once your illness and your deficiencies are sorted, this will get better. Now, when we come to the physical disorders, sometimes there can be like a growth, a cyst, a small abscess, which can lead to pain. Now, this will also lead to a pus-like discharge or bleeding after sex. Therefore, bleeding after sex should never be ignored and you should consult your gynecologist immediately if you're having pain along with bleeding during sex. The other thing is a mental problem wherein we are facing compatibility issues. There's not enough foreplay. You're not comfortable with your partner. You're having frigidity or vaginismus. And all this is causing anxiety, is causing a lot of mental disturbances. And so maybe with one partner, with that particular partner, you are having pain or dyspareunia. So in this case, you need to first figure out where the problem is. You need to, maybe explore yourself. You need to do some self-love, do some reading, explore and see why is this happening. Use lubrication. Always use a water-based lubricant because an oil-based lubricant can hinder with the usage of your condom as well as cause infections. So always use a water-based lubricant, a lot of foreplay of course, and still if you're having pain or if there's discomfort or if you're not enjoying sex, there is no harm in showing it to your gynecologist. And then if your gynecologist thinks that you need therapy, you need a sex therapist, or there is some local problem, there's an infection, there's some kind of an illness which needs medication, we can totally sort it out. So please remember, sex is not supposed to pain. A weird sensation, a pain, discomfort, displeasure is not normal during sex. And if your vagina is aching during sex, it's called dyspareunia. It's a proper condition, it has its causes, and you need to seek your gynecologist ASAP. I hope this was helpful. Bye.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.